In the field of addiction treatment and recovery, today's hurdles are complex and, in many ways, unlike anything we have experienced before. At CODA, we continue to focus on community and collaboration to adapt and to create innovative solutions to help improve our patients' lives.
My name is Sheila Clark. I'm a supervisor with Washington County Community Correction. Around 2017, 2018, we really started to see an influx of fentanyl. Oregon was going through like a crisis. Our prisons were full. People weren't getting the services they needed in the community. People weren't getting clean and sober. They couldn't stop. They would be picked up. They would serve time in jail. They'd get out and they'd start using right away again. There was a specific need to reduce the prison population as well as provide services to our highest risk clients who are facing prison to change the trajectory of their life by putting them in intensive services and doing that work up front.
So my name is Kathy Prenovo. I am the addictions supervisor for Washington County Behavioral Health Division. Sheila Clark and I helped develop the IRIS program. There are some specific programs that CODA is involved in that really target an individual by offering medication-assisted treatment, support and resources, help them develop a recovery community so that somebody else in their lives cares whether they're clean and sober.
My name is Jason Jones. I'm the Justice Reinvestment Program Supervisor here with Washington County Community Corrections. The thought is that once a client gets a certain amount of treatment dosage through attending treatment services with providers such as CODA, working with a mental health provider, engaging with recovery mentors, working with probation officers on a weekly basis, that eventually they'll get enough treatment dosage where they'll make the changes needed to where they can exit the criminal justice system and not come back.
There wasn't anything that was in existence at the time that focused on women and families.
And my name is Marnie Sadek. My position at CODA is the treatment team coordinator for the FSAP and IRIS program. The FSAP program has given such a wonderful opportunity for moms and children because the mom does, the kid does. The mom's getting more confident. The kids are getting confident. In our first couple of years of FSAP, we've saved the state millions of dollars by keeping kids out of foster care and keeping parents out of incarceration.
This is about saving lives and about healing our community and giving community resources to move forward and to understand that drug addiction is something that affects everybody, and it's really more about recovery rather than the disease itself.
My name is Emily Fox. I work for Central City Concern, Old Town Clinic in Blackburn as a Hep C outreach specialist and linkage to care.
My name is Mark Rizzo. I am the Pharmacy Clinical Services Manager.
Central City Concern launched its Hepatitis C program in 2017 with the ultimate goal of eliminating the disease in our community. Since combining forces with CODA in 2022, the program has led to 1,045 patients being tested and 65 being treated.
CODA does the dry blood spot testing at intake with the patients. Then I pick the tests up once a week by sending them out to the lab for processing. And then as they're coming back positive for Hep C, then it's my job to connect with those people and get them into treatment. Part of my position is trying to connect people in the community that we know are Hep C positive that maybe have been lost to follow-up.
CODA has a very established patient base in the area, and they're a pillar in terms of opioid treatment. And our relationship allows us to open up the patient base to test and treat patients who would have never been seen in Central City Concern location.
My name is Clark Miner. I am the Senior Clinical Program Manager for the Seaside Recovery Center. CODA is really focused on doing what we can to reduce the stressors in patients' lives and remove barriers for services. We're excited about being able to implement just one more additional piece that promotes health and wellness for our patients.
Being at CODA is like such a great spot because people go there like daily, and it's such an awesome opportunity to connect with people that I can't find otherwise.
CODA has been able to partner with organizations that offer alternative, recovery-based treatments for our patients.
My name is Witsi Goodson. I'm a punk here at WCA, that's short for acupuncturist. WCA is a community acupuncture clinic, and what that means is that we are low cost and high volume. CODA was starting buprenorphine along with methadone, and part of the regulations for how that gets dispensed meant that patients took it sublingually and had to sit for 15 minutes and be observed. Lisa, our founder, and Allison Noyce, the executive director at CODA, hit on the idea of doing acupuncture as a way for people to have something to do, to sit in silence for 15 minutes, and then as people feel like they're done, they can get up and go. And for people going through recovery, trying to figure out new ways to feel good and to feel normal, that's really powerful.
I am Izzy Alvarado, and I am the founder and executive director of Go the Distance. We facilitate runs at local treatment centers, and we really appreciate being part of the CODA family. Last year alone, we had 496 people sign up for our services. We encourage them to run with us 12 times. When they do, we award them a new pair of On running shoes. What it's offering is more than just taking people out of the treatment centers for that 1 hour a day. We are building a community. Communication is one of the biggest parts of recovery because it's one alcoholic working with another alcoholic, sharing their experience, strength, and hope.
Healthier activities, healthier communities, entering treatment instead of prison. These creative innovations are just some of the ways CODA has been able to expand patient services by collaborating with our community partners. We look forward to working together to meet the shifting hurdles that face our communities today and into the future.